As a safety practitioner, as a site supervisor, you must understand what is health, what is safety, and what is the meaning of mental health. There are several definitions for health. For example, physical and mental well being, freedom from disease, pain, or defect, normalcy of physical and mental functions, soundness. Another easy and simple definition of health is soundness, especially of body or mind, freedom from disease or abnormality. Health means a state of well being, a balance, often physical, but sometimes also mental and social. Health also means the state of being free from physical or psychological disease, illness, or malfunction, and the wellness. In general, we are saying health means freedom from disease. Now, after discussing several definitions of health, let us understand what is mental health. Mental health is a state of well being in which a person understands his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Both physical and mental health are the result of a complex interplay between many individual and environmental factors, including number one, family history of illness and disease or genetics. Number two, lifestyle and health behaviors, for example, smoking, exercise, substance use, etc. Number three, levels of personal and workplace stresses. Number four, exposure to toxins. Number five, exposure to trauma. Number six, personal life circumstances and history. Number seven, access to supports, for example, timely healthcare, social supports, etc. And number eight, coping skills. These are the factors, contributory factors, those may affect the mental health level. Dear friends and fellows, when the demands placed on someone exceed their resources and coping abilities, their mental health will be negatively affected. Two examples of common demands. Number one, working long hours under difficult circumstances. And number two, caring for a chronically ill relative or friend. Other factors, those may affect the mental health, might be economic hardship, unemployment, underemployment, and poverty. All these factors can potentially harm to mental health of an individual. So, when we are talking about mental health, we should understand what are the factors that may affect the mental health. You are on the platform of Safety First Life. If you're first time on this channel, kindly subscribe it and press the bell icon for all future notifications. And if you find the video informative, then like, comment, and share it with your friends and colleagues. Now you have a better concept about mental health. Do you know what is mental illness? Mental illness is a recognized, medically diagnosable illness that results in the significant impairment of an individual's cognitive, affective, emotional, or relational abilities. Mental disorders result from biological, developmental, or psychosocial factors and can be managed using approaches comparable to those applied to physical disease. For example, prevention, diagnosis, treatment, and rehabilitation. Mental health is a complicated subject as compared to mental illness because mental illness can be recognized, can be identified with few signs and symptoms. Another important question, and sometimes it is being asked, When you are going for interview for managerial position, the company directors or the general managers, they are asking what is psychological safety and health. They will not ask you what is health and safety because your level is high, dear friends and fellows. The Oxford Dictionary defines psychological as of relating to, affecting, or arising in the mind. The concept of psychological safety involves preventing injury to the mental well being of workers. A psychologically safe and healthy workplace is one that promotes workers' mental well being and doesn't harm employee mental health through negligent, reckless, or intentional ways. For example, a psychologically safe workplace could be free of excessive fear or chronic anxiety. Another important question: what is the difference between a mentally healthy workplace and a psychologically healthy workplace? There is no difference at all. Psychologically healthy workplaces and mentally healthy workplaces both describe the same high functioning, respectful, and productive workplace. The term psychologically healthy workplace is often used when talking about preventing psychological injuries, for example, stress related emotional conditions resulting from real or imagined threats or injuries. The term mentally healthy workplace is often used within the context of mental health promotion and is viewed as a strategy used to reduce risk factors for developing mental illness. Very easy words, clear and concise. You can understand what is the meaning of psychologically healthy workplace and mentally healthy workplaces. Let us discuss now how do psychosocial risk factors in the workplace affect employee health. Dear friends and fellows, workplace health and safety has traditionally focused on addressing hazards that could cause physical harm, such as injuries to the body. For example, cuts, bruises, broken bones, etc. To have a complete or comprehensive approach, workplaces should also give the same priority and attention to psychological hazards. There is strong evidence that workplace management practices, communication systems, and participation systems can influence employees' mental health in both positive and negative ways. Do you know how do psychosocial risk factors in the workplace affect employee health? The term psychosocial factors is often used to describe these practices and systems. Number one, positive influences that make you feel energized, positively challenged, motivated, and engaged. And number two, negative influences can make you feel frustrated, burnt out, unmotivated, and disengaged. 180-degree out of phase, positive influences and negative influences, but both coming from where? Psychosocial factors. So, you should keep your sight always on positive influences. How? We are going to learn, dear friends and fellows. You are on the platform of Safety First Life. Today, we are talking about mental health and psychosocial risk factors. Several psychosocial risk factors have been identified by researchers based on extensive research and review of empirical data from national and international best practices. These organizational factors that impact organizational health, the health of individual employees, and the financial bottom line, including the way work is carried out and the context in which work occurs. These are very important points. How you can manage mental health problems. Once you have clarity about these 13 elements, you can prepare a comprehensive, suitable, and sufficient risk assessment. You can manage health problems on your work site. You can manage and maintain best health and safety standards on your project site. What are these psychosocial risk factors? Number one, balance. Number two, civility and respect. Number three, clear leadership and expectations. Number four, engagement. Number five, growth and development. Number six, involvement and influence. Number seven, organizational culture. Number eight, protection of physical safety. Number nine, psychological competencies and demands. Number 10, psychological protection. Number 11, psychological and social support. Number 12, recognition and reward. And number 13, workload management. Very important point. If a health and safety practitioner loves to understand the bottom line of psychosocial risk factors, they should go in detail. I'll make a separate video on these 13 points. Those are about psychosocial risk factors. Training session related to mental health, mental illness, and the basics of psychosocial risk factors is over. If you have any question, please ask in the comment section. Thanks for watching, and don't forget to like, comment, and share the video. Hope to see you soon with a new HSE tutorial. Until then, take care. Good luck and goodbye.